Hello, I'm Llewellyn King, the co-host of MECFS Alert on YouTube, the program developed by myself and by my colleague and friend Deborah Worob to look at the issues confronting patients of this disease. And today we're very lucky to be talking to Dr. Kenny de Meirleir from Brussels, or rather from Belgium, who has treated between 15 and 20,000 patients, many with success. And I'm very interested in his record of success because by and large we don't hear of a lot of success. We hear of a lot of sustenance, failure, maintenance, and despair, unfortunately. Do you think you're more successful, doctor, than other physicians in your treatments?
I can't compare because I don't know what in other practices happened. You know?
But you believe 60% or 50%?
Yeah, at least 50%.
Get well enough that they don't need you anymore?
Yeah, there was an independent exam of my patient's outcome, and it was 71% that was better, but you have to subtract, of course, the placebo effect from that. So, but still over 50%.
What do you think the placebo effect is? Do you have a figure, a number on that?
For the studies in the MECFS, the placebo effect is on the average between 12 and 20%.
Is there any part of the world where you feel that the medicine is superior for this disease?
No, I don't think so.
Do you think that any country handles it better or handles its patient population better than any other country?
No, with all the studies that have been done with CBT, a lot of governments are impressed by these studies. And in Belgium, there was an independent examination of a study which has 808 patients that were given CBT and exercise therapy, and only 6% got better, which is in contrast with the published studies. And here it's about 808 patients. The government paid €6 million for that study. And important to know is that 30% get worse.
Would you like to spell CBT out for us?
Cognitive behavior therapy. And so only 6% got better, 30% got worse, and 64% did not get better. And that was published in 2005, not in a journal, but in some official government paper. But nobody really looked at it.
In the United States, we see a huge difference between the money spent on different diseases, and somewhat that is influenced by celebrity. We saw, for example, in the early days of AIDS, patients shunned, as they have been with MECFS, and later when you got celebrities involved, and when the scope of the disease became apparent and the number of creative people who were dying from it, suddenly it became a very different kind of social acceptance, and huge research was thrown into it. What do we need in this disease, in MECFS Alert, to light the fires of creative research?
Well, we looked at infections in these patients, and I think if they were to give blood, these patients, they would infect the whole world, because they have multiple infections, active infections in their blood, because the immune system doesn't work properly, and I think there's something that's been overlooked. Several people have published on these infections, but nobody really takes notice. And if you have that multitude of infections and say it's just nothing, and you have a chronic inflammatory response all the time, then this should be looked at.
What are your feelings about contagion? We see families where several people are affected. I get really harrowing letters from people whose children, and then the caregiver is affected, sometimes the other way around. And there's one family where there are two gorgeous young children, and one of the parents is infected and has to go to enormous lengths to protect the children, and it affects the marriage and the structure of the marriage. Everything has to be very carefully worked out because the path of the pathogen is not known.
Well, it's a very sensitive subject right now, and don't want to talk about this because there's work in progress, and we are going to publish something on that this year or next year, because this study needs to be very careful and carefully done, because if you publish something like that, that might create big panic, and this study just needs to be perfect, otherwise we don't publish it.
All right, and you're confident of this study. When will it come out?
Well, I said later in 2013 or in 2014. The analysis is being done right now, but it has to be written up.
Linked to contagion are clusters.
Clusters and family, also families.
Yeah, well, leaving aside families, we've seen these large clusters, Nevada, New York State in this country, years ago, the hospital in England, the Royal Free Hospital, I think it was. There's a linkage there, is there, between contagion and clusters? But clusters sometimes suggest an environmental factor, an external factor, rather than a contagion.
I think it's both in this case. We have evidence that it's both.
It's both external environmental factors and contagion.
Yes.
Usually working together with a disastrous
That's
result.
why there's not more people infected, you know. So you need a combination of two.
How do you find the drugs that you prescribe? You're an expert, or you're a scientist as well as a doctor, so you know a great deal about these drugs. Do you pursue literature? Do you say there's a new drug, this might work? Or
we don't use any new drugs.
No, all well established in the pipeline drugs. But even so, there's a great discrimination among patients necessarily.
Yeah, because you have to have the appropriate diagnostics. You don't prescribe. I mean, the only thing you can do without diagnostic is to improve sleep and pain and a little bit the fatigue. But that's all you can do if you are a regular doctor just looking at these CFS-ME patients. You cannot go any further than that. So in order to take the next step, you have to have some diagnostic workup and see what's going on.
What brought you to your interest in?
I am basically an internist and a cardiologist, and I was asked by psychiatrists to evaluate a bank director who was very motivated, made a lot of money, and he had to go home at 11 o'clock in the morning because he was dead. And the psychiatrist said, there's something wrong here because my depression scales say 0. Okay? And I'm a serious psychiatrist, there is something wrong here. And he asked me as an exercise physiologist, because I did my PhD thesis on that, to see whether this patient had some diminished physical capacity. And this guy only had like 40% of his normal maximum oxygen consumption. So for his age, which is extremely low, and it's normal because if you only had 40% of your VO2 max, you do everything at 40% of your VO2 max. We climb stairs at 1/3 of our VO2 max. But if you only have 1/3, then you do everything at your maximum. And that means you have some problem with your oxygenation of your muscles or with the production of ATP.
You mentioned depression. If somebody comes down with this disease, that's reason to be very depressed. But is it a precursor sometimes?
No. I mean, what is depression? Who can tell you what depression is? The clinical picture of depression is that people are not interested in anything anymore, don't want to do anything anymore. Here it's just the other way around.
Do you believe that in the near future we'll get a, quote, cure for this situation?
I think within 5 years we will be able to help 70% of the patients. Those who've been sick for 30, 40 years and have a lot of abnormalities at the molecular level, they're going to be very difficult to treat.
Doctor, what is going to happen within 5 years? What is the seminal thing that's going to bring this about?
we're going to understand this other form of chronic inflammation and immune depression. We're going to understand why that is. And if we understand why that is, you can treat it. You can do clinical trials, placebo-controlled, and you convince everybody. And now we have pieces of that, but it's a little bit like the puzzle of the Mona Lisa, you know? You have 1,000 pieces, and you'll have to put in 400 or 500 before you will see that's the Mona Lisa. Okay, I think we are there now, but the puzzle needs to be completed before our colleagues will believe us, and before we can go into clinical trials where we take a certain subgroup of patients that's very homogeneous in biological abnormalities and treat them accordingly.
What do you think of the numbers of people affected? There are two numbers that are commonly used in the US. One is that there are 1 million US sufferers, and the second one is that there are 17 million global sufferers.
I think it's totally underestimated.
Underestimated?
It's much, much more.
There are people who think there are 4 million sufferers in this country.
Well, it's possible. I'm not an epidemiologist, but I think there's more, because often, you know, the husband of the patient says he or she is feeling not optimally, and it really depends where you make your definition. If you say you really have to have lost 50% of your capabilities, then maybe these numbers are right that they cite. But if you take all the other people that have lost some of their capabilities, then there's much more.
Doctor, it's fascinating to talk to you, and I want to congratulate you for your optimism. We need some optimism in this business.
I think so too, yeah.
Super. Thank you so much.
If you would like to sponsor MECFS Alert, please contact us at mecfsalert@gmail.com. Help us to help you.